And joining us now, Stephanie Wagner, spokesperson for the American Red Cross in Louisiana. Can you please update us on the latest relief effort happening right now as your state gets ready for a storm surge, which has been called unsurvivable?
Yeah, we've been readying our workforce and stocking up supplies, staging them in areas that can be easily accessible for days, almost a week now, to make sure that we can respond to whatever may come. And we're very glad that we were planning a few steps ahead, as we weren't sure what the extent or the depth of this event was going to be. And with it now coming on shore as a Category 4, potentially Category 5, we are continuing to force our localizations and officials to make sure we can respond accordingly.
What's your biggest piece of advice for someone who's still in a danger zone and how the Red Cross can help?
Well, first, we want to encourage anyone to listen to the direction of your emergency officials. They know what the right thing is to do, and we want to get you out of harm's way, as do they. So please listen to your emergency officials, and if they tell you that you need to leave, please leave. If you have passed the point of no return where you are unable to leave, please go to a higher level of your home. You need to go in an interior room in the event that there are any tornadoes, and you need to just keep a very close eye on what is happening with the weather outside. After this storm has passed, as we start to see what is happening in the environment and the scope and the extent of the damage that has occurred, we encourage folks to call 1-800-RED CROSS, and we will be there to support them with whatever they need.
And of course, we're still right in the middle of a pandemic as well. The Louisiana governor today called it a serious issue, still imploring people not just to pay attention to the storm, but also COVID. So how challenging is it to deal with both an active pandemic and a major storm at the same time?
There are certainly complications that come with dealing with COVID-19 in the midst of a multiple hurricane scenario. But what it's allowed us to do is really hone our skills to assure that we are delivering our services in the safest, most comprehensive way. We're providing PPE for any resident should we need to open up any shelters. We are adjusting how we deliver services for a lot of those to actually be done in a virtual capacity, including casework and disaster health and mental health services. And we are able to fulfill all the needs of a community with a portion of our workforce on the ground and the rest of it being done virtually. But our delivery as far as what we are going to do for the communities has not changed.
And what's being done to help the most vulnerable who typically would be brought to mass shelters and require medical care?
So our state is handling all of the sheltering at this current time, so I can't speak to those details exactly. But what I can speak to is our Red Cross shelters. And as folks are coming into our Red Cross shelters, they are going to be cared for. They will have their temperatures checked. We will have additional screenings. We will actually have people separated into a general population and an isolation area, so those who aren't feeling well or may have come into contact with somebody who is COVID positive, they can still feel comfortable in knowing that they should seek help and they can come to seek refuge with the Red Cross at any point in time. And we will have health services individuals there as well to meet the needs of those individuals that are a little bit different now with this pandemic.
Stephanie Wagner with the American Red Cross. Thank you so much, Stephanie.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.